Hello friends, I am Dr. Banshi Saboo, President RSSDI. As office bearers of RSSDI National Executive Council, we have come together to bring to you important points from our RSSDI advice documents on COVID-19 that offers you scientific know-how on staying informed in these times.
Corona infection is pandemic worldwide now. Millions of people all over the world, including India, are affected. So we are taking this initiative to educate people for taking precautions to avoid this disease and also how to manage their health conditions and comorbid conditions during this pandemic.
You can contract COVID-19 infection from an infected individual, especially with a close proximity with that patient, maybe with handshaking or hugging. And also it is possible that if you touch certain doorknobs, maybe surfaces, handles, from there also if it is harboring virus, then it is likely to get passed to the individual, especially if you have not washed your hands for about 20 seconds before touching your eyes, nose or ear. So it is very important to wash your hands frequently for about 20 seconds.
People can have COVID-19 infection when they breathe in droplets coming from a person already infected with COVID-19 following a sneezing or coughing when in close proximity. It can also be contracted through fecal-oral transmission.
The most common symptoms of COVID-19 are fever, cough which can be quite severe, and tiredness. And many of the patients might also complain of diarrhea, nasal congestion, running nose, muscle aches, and even a loss of the sense of smell.
Patients with diabetes who have coronavirus infection tend to have severe symptoms and complications, especially those who are elderly, those who have comorbidities like heart disease, kidney disease or chronic lung disease, patients with cancers or those who are immunocompromised. These patients tend to have worse outcomes due to their poor immunity.
In type 1 diabetes, there is a bigger risk of having diabetic ketoacidosis if your blood sugars are uncontrolled, particularly in the background of any viral infection and if you miss doses of insulin. Therefore, for all our type 1 diabetic patients, please stick to your insulin doses, don't miss a single dose, and make sure you have enough insulin at home.
As of now, there is no vaccination for prevention of COVID-19. You do not need to start any drug prophylactically unless and until you have any symptom. A number of treatment options as well as vaccines are under trial, and we are in collaboration with most of the world authorities. The moment we get the information, we will come back to you.
Unfortunately, if someone tests positive for COVID, don't be afraid, because most of the patients will improve and become normal. Even those who are critically ill, there are plenty of success stories.
A large number of patients carrying corona infection may be only asymptomatic carriers. Those who are infected, again, majority of them will they will improve or get cured only because of their innate immunity, and they will not need any special treatment or hospitalization. However, they may still be transmitting the virus to people around them, and they may be instrumental in spreading the infection. So it is very important to take care and take adequate precautions like home quarantine, keeping social distance, wearing masks, and washing hands. Thank you.
Maintain social distancing. Keep out of very large gatherings like meetings, malls, or even places of worship. Keep a distance of at least 2 meters or 6 feet from the person next to you. This is particularly important if there is somebody with symptoms of fever, cough, or cold.
Wash your hands with soap and water frequently for at least 20 seconds. If soap and water are not available, you can use a hand sanitizer that contains at least 60% alcohol for cleaning your hands. Don't touch your face, particularly your mouth, nose and eyes, especially with unwashed hands.
As far as possible, please avoid touching objects which you frequently touch, like lift buttons, doorknobs, and handrails. Also, objects which you touch frequently should be disinfected. Use your hands wisely.
Wear a mask if you have symptoms of cough, fever, or difficulty in breathing, or when visiting a healthcare facility, or even when you're out on an emergency errand. Remember, do not reuse the same mask again. If you have to cough, cough in your elbow in public to avoid exposure to others. Do not spit in public.
As patients with diabetes, you should have your diabetes management plans handy that includes your current prescription, contact details of your doctor, pharmacy, and insurance for any emergencies. Keep an adequate supply of your medicines, devices like your pens and your pen refills and needles or pump supplies and glucometer strips always handy.
If you have diabetes and have symptoms such as cough, high temperature or shortness of breath, stay at home. Avoid coming in contact with others around you. Continue your medications and contact your physician or local public health authority for further guidance.
If you come in direct contact with a laboratory confirmed COVID-19 asymptomatic patient, then you must be quarantined for 2 weeks and observe all the precautions as outlined by Ministry of Health and Family Welfare, Government of India. Going forward, you may have to be tested for COVID-19 and if found positive, need to be treated as per protocol.
People can get infected with COVID-19 virus through nose and mouth by droplets from coughing and sneezing of an infected person. The patient with diabetes, hypertension and heart disease, if infected with COVID-19 virus, may develop serious complications.
Don't believe any unscientific information from unreliable sources circulating on social media. Just trust the most scientific information given by ICMR and Ministry of Health and Family Welfare on their website. Stay at home, stay safe, stay healthy. Thank you very much.